Hi, my name is Brandon Hanten. I'm a second-year medical student at the USD Sanford School of Medicine. Today we're going to give you a walkthrough of the Redfield clinic here connected to the hospital here in the city of Redfield, South Dakota. So as you can see here, this is the main entrance to the clinic, which is attached to the hospital here. They have a makeshift wall with sanitizing and a check-in for the COVID. So as you come in, you're screened for all the different symptoms, and you are donning a mask and running a temperature and signing in at the time that you get here. As you can see, the clinic is closed right now. They've also done spacing in the seating area to allow everyone to have their 6 feet of spacing while we're waiting. And then we have, obviously, the sanitizers in the bathrooms over here. So now we're going to move back into the exam room area. So the clinic has 17 exam rooms. There is as many as 7 different providers practicing at any given time on a day, depending on who's scheduled to be working that day. The nurse's station is here. Here's your standard exam rooms right here. We'll just show you one of them right now. Standard exam room in the clinic. Has everything that you need. Not much different than any other exam room that you would see at any other facility. There is a provider's office in almost every bay. They have the procedure room and the lab here as well to draw blood if they choose to. These are all locked for the night though. And then there's also an adjacent hallway on the other side of this wall, which also has exam rooms on the other side as well. Yeah, that's pretty much it, I think. So then we'll move on into the hospital, which is the Community Memorial Hospital here in Redfield.
My name is Nathan Graves. I'm a third-year pharmacy student at South Dakota State University, and we're going to continue our tour going through the hospital here. So as we're looking through here, there's a lot of specialties that come into the hospital that are usually kind of centered in this area. They travel from Aberdeen at Avera St. Luke's. And over here we have kind of a storage area that leads down into the basement with a lot of the storage and cafeteria that's down there. And then we'll go down this hallway where we have radiology waiting room. And then we have some of our other offices, such as the radiology office, which will be locked tonight, as well as laboratory, and then the pharmacist clinic. So the pharmacist here on duty has an ambulatory care clinic where she sees warfarin patients usually 2 or 3 days a week, and her office is right in there. So let's continue on to the front of the hospital. So they have 2 doors for registration here and a registration booth where we, due to COVID, are taking our temperature and signing in to kind of keep track of visitors each day. And just to see the front of the hospital here, so we were connected to the clinic over there and we're connected to the front of the hospital over here.
So now we're going to pick up from the main entrance of the hospital and head in towards the ER and inpatient part of the hospital here. So here's our wall of providers, as you can see on the wall. There's 3 docs at any given time and then 4 mid-levels. So here's our ER part, nurse's station, where they're all working so diligently. And then right back here, if you follow me, is the ER bay, where we have the 2 different trauma bays set up for a patient at any given time. This is staffed 24/7. It's a critical care hospital, so open. And then right into here is the ambulance bay.
So this is the ER entrance to the hospital, and if we take you over here, they dedicated one of the wings of the hospital to a COVID unit. And so if we start out over here, they've got an entrance log area here, and then the gowning area for their COVID unit. And you can take a peek at that, and then we'll take you down here where we can kind of see what's going on down here. Of course, just like a normal room, they've got janitorial and toilet stations, and then they've got about 4 exam rooms that all have negative air filtration. We'll be able to take a look in this one right here so we can see that HEPA filter with the negative air filtration so that when COVID patients come in, they aren't going to be contagious and infective to the rest of the hospital. And then we can kind of take a look down the rest of the way here too, where we can see kind of the soil utility and clean linen area down at the end of the hallway with 2 more exam rooms down here. And then as you can see, it connects to the rest of the hospital in the other hall.
So now we're on the western entrance to the hospital. This is focused mostly on the therapy part of the hospital. They have physical, occupational, and speech here. As you can see over here, we have our waiting room, which is also spaced out, same as our waiting rooms for the other 2 parts of the hospital. Down this wing, you have all of the offices of all the therapy and the multiple different therapy rooms down the hallway. They're all very similar to exam rooms, as you would expect. We have the boardroom for the hospital right there. And then down this wing over here is more the administrative side of the hospital, where we have the CEO office, HR, billing and administration, and then at the very far end there are a couple of on-call suites for any locum doctors or doctors that are staying here for the night on call at the ER.
All right, we got Dr. Owens here with the CMH medical staff. And what we're going to ask you first is, what made you decide to enter into the healthcare field? And give us some background information on you.
I decided to go into the healthcare field pretty much early on. I joined the U.S. Army when I was a junior in high school and went to medic school and went back, finished high school, and then went to USD and did the athletic training thing and the EMT, and just kind of grew out of that.
Yeah, great. What made you choose a rural location to practice?
Part of the working in a medical underserved area is get a lot of satisfaction, especially in the form of healthcare prevention. And when I was earlier, the challenges of emergency room and trauma and that sort of thing was quite compelling. To be blunt, now I really like doing geriatric care and long-term chronic disease management. But
could you explain to us what it means to be a critical access hospital and how it affects day-to-day operations?
Yeah, critical access care hospitals came into existence, I believe, in the late 80s, early 90s, as the profitability of rural hospitals decreased because we don't do a lot of high-dollar procedures. We do a lot of high-touch sort of care. For example, elderly that need to have their heart failure tuned up or in the hospital for after they've had a hip repair. And that came about as part of a federal program because there was quite a shift in how healthcare was provided in the 70s and 80s with the more high-dollar procedures going to larger communities. And so we do a lot more rehab-type programs and chronic disease management.
What are the perks or advantages of working in rural healthcare?
Like one of our mid-levels here said, we don't necessarily really have patients. We have friends and neighbors that we take care of, and it's. I've been here 21 years, and some of these folks now I'm working on them with the 3rd generation, so it's rewarding in that respect.
Cool. What are the biggest roadblocks you've encountered in rural healthcare?
Just in general, not specific for Redfield, but in general, the recruitment and retention of physicians has been a real issue. It's kind of odd because when you have a shortage of something, you usually pay more or the price of that goes up, whereas in rural medicine, when you have a shortage of something, there's no commensurate change in recruiting and retention and just the cost of, even though in the bigger picture it's been shown that rural healthcare facilities have extremely high patient satisfaction levels, and our quality of care is also quite good.
2 more questions. How can students like us best work to improve the rural healthcare system?
Well, if you obviously go into it and work within the rural healthcare system, and if that is not within your plans, is to be advocates for it.
And then lastly, what would be your takeaway advice that you have for students based on your experiences in healthcare?
Change is inevitable. Change has been the only constant my entire career.
Well, sounds great. Thanks for interviewing with us.
I'm Adam Hansen. I'm the finance officer for the city of Redfield, which owns Community Memorial Hospital.
All right, first question. How did you end up with a career in rural healthcare administration?
Well, it's kind of funny you asked that because when I took this job as a finance officer, usually a finance officer and healthcare have nothing in common. But being one of 3 city-owned or county-owned facilities in the state, that was just came along with part of it. So it was purely by accident.
Fair enough. What is it like being in a community with a community-owned hospital and clinic as opposed to being part of a larger healthcare system?
Well, it's kind of interesting. There's its advantages and disadvantages. I like it because Dr. Owens or Dr. Wren or any of the PAs, you know them by name. It's not just a name or a face or there's 87 doctors. I mean, it's very personalized, and that's what healthcare should be about.
What challenges have you faced during your time in rural health system administration?
Well, I don't think this is just for rural, but for all hospitals, is funding. Our hospital doesn't turn anybody away, whether they can pay or not. We have had some issues with cash flow, which most hospitals have had. The only nice thing about being city-owned is there's taxes behind it if there is a shortfall, which we've had to cover. And so I'd have to definitely say funding is the biggest crisis we've had in the past.
Okay. How involved are you in the recruitment of employees into rural healthcare? And could you kind of give us a rundown of how that looks?
Well, like I mentioned earlier, being one of only 3 city or county-owned in the state, it's a little different because there's a hospital board and they have their own HR person, but then everything has to be approved by a city council. So there's multiple different steps that probably aren't in a normal hospital. So back to your question of how involved I am, I'd say I'm very involved because at certain points city council looks for a recommendation from me whether this is a good hire or not a good hire. So we all work together as a team between the hospital and the city, and it works very well.
Okay. What advice do you have for students regarding rural healthcare and employment?
If I was a rural health care student, I would definitely pick a small town because in my own career path, I didn't ever want to come back to a small town. I was going to go to this big town and save the world. And then I fell into this job about 14 years ago, and it's the best place to raise a family. And like I said earlier, with healthcare being personalized, you're not going to get that personal care in Sioux Falls or in Aberdeen, but in a Redfield and a rural community you will.
What is your favorite aspect of Redfield?
I'd have to say just Redfield is a small town, but for South Dakota it's a large town. So I like it. We have the amenities, we have the hospital, we have all the facilities and the recreation things after work, but we're small enough where I still know who my neighbors are down the street. So I'd have to say the tight-knit community is one of the best things about Redfield and any rural community for that matter.
Okay.
Well, that's all the questions we had. Thanks for allowing us to interview you.
Yes, thank you, gentlemen.
Our information for this video was provided by a paper written in 2018 by 2 previous REHPS students on the social determinants of health in Spink County. Social determinants of health are factors that determine a person's access to health care and ability to lead a healthy life. They are broken down into 5 subgroups: social or community context, economic stability, education, healthcare, and lastly, neighborhood and environment.
According to 2016 data, South Dakota has a statewide population of 865,454 people, where 82.4% were white residents, 8.5% were native residents, 3.72% were Hispanic residents, and 1.66% were African American residents. This information shows that there were roughly 9.7 times more white residents in South Dakota than other ethnicities. In comparison, Spink County has a population of 6,539, consisting of 93.6% white residents, 3.2% Hispanic or Latino residents, 2.7% Native residents, and 0.7% African American residents. The average resident in South Dakota is 37 years old compared to 44.1 years old in Spink County. This indicates an above average age in local residents. we found that Spink County has a typical social and community context to other counties in the state with a mostly rural population.
In terms of economic stability, Spink County's median household income in 2016 was about $49,000, whereas the state average per household was about $54,000. However, the poverty rate in Spink County at 11.1% is lower than the South Dakota rate at 13.3%. This is indicative of a relatively stable economy in this county.
In terms of education, Spink County has a high school graduation rate of 91%, which is very comparable to the state average of 91.7%. However, the 22.2% of residents who continued on to attain a bachelor's degree or higher is roughly 6% lower than the state average. It is worth noting that there are multiple public community colleges located within the region. In addition to this, the most commonly awarded degree type in Northeast South Dakota was an associate's degree, with general agriculture management being awarded at a rate which is 4.93 times above the national rate. Therefore, the lower rate of bachelor's degrees in this county may not properly represent the education level of this county.
In terms of health and healthcare, there are 75 primary care physicians per 100,000 residents in South Dakota, whereas in Spink County there are only 30 per 100,000. Additionally, Spink County only has 31 mental health professionals per 100,000, which is well below the state average of 151 per 100,000 residents. This is a glaring issue this county faces that must be addressed, but it is a common theme amongst many rural communities across the state. The average reimbursement per Medicare-covered individual is about $2,000 higher in Spink County than in South Dakota as a whole, which may indicate that the elderly in Spink County have more access to health care. The national average reimbursement per Medicare enrollee is comparable to the average in Spink County, about $10,000 per enrollee. Although there is a higher prevalence of motor vehicle accident deaths in Spink County, the rate of other things that affect the health of a population, such as drinking, smoking, and diabetes, is comparable or lower than other counties in the state.
The average cost of property in South Dakota is around $160,000, while in Spink County it is $74,400. On average, residents of South Dakota pay an average of over $3,000 in property taxes. This amount is much lower in Spink County at an average of less than $800. There were roughly 67.2% of South Dakota residents that own a home, whereas the number is larger in Spink County with a home ownership rate of 72.9%. Car ownership is equal in Spink County to that of South Dakota, with an average of 2 cars per household. One concern presented in terms of housing is the distance that one may have to travel to receive health care, which is a common concern in rural South Dakota. Spink County has a population density of 4.3 people per square mile throughout the county. Despite the lower average income discussed earlier, this data indicates Spink County offers an exceptionally affordable place to live.
The economy in Spink County appears stable, property is affordable, and the poverty rate is below the South Dakota average. Because agriculture is a major employer in a rural setting, the data provided does not provide proper insight into whether education is negatively impacting access to health care. It is worth noting that Redfield just built a new school, which shows a commitment to the education of the children that live here. Although there are generally less healthcare professionals in Spink County, the reimbursement per Medicare patient is above the state average. Motor vehicle accident death rates are slightly higher in Spink County, but other activities or conditions that affect health are average or below average in comparison to other counties in the state. Demographic data suggests a fairly typical social and community context for rural South Dakota. Lastly, in terms of housing, the data depicts Spink County as an affordable, clean, and quiet place to live. To summarize, the data collected regarding the 5 social determinants of health suggest an overall positive trend to access to health care in Spink County.